Welcome back, everyone, to Open Line. Fascinating show tonight. We are talking with Dr. Milstone, pulmonologist at Williamson County Medical Center, and also Isaiah Whalum. He is a COVID-19 survivor. He is 46 years old. He was in the hospital for 53 days. We were just talking to him. He was on a ventilator. His story is remarkable. And I want to ask you, before we start taking calls, Dr. Milstone, how serious was his situation? How close to death was he?
Well, I think there are a couple striking points of Isaiah's story. The first is his age. 46, healthy, didn't know where he got the COVID-19. I think we've done a bad disservice to our country by saying that this is a disease of nursing home patients or patients above the age of 70. When that's just not the case any longer. And we're seeing plenty of young people, even down to age 2, succumb to the illness. Isaiah's story is very complicated. He was hospitalized in ICU for essentially 2 months. There were multiple days when it looked like he would not survive the day. His blood pressure was extremely low and it required medication to raise his blood pressure. And unfortunately, it didn't just affect his lungs, but COVID also affected his kidneys, and his kidneys shut down. Isaiah ended up on hemodialysis and had to have dialysis during the hospitalization. And then his lungs were so scarred and injured from COVID-19 that in order to get him off of life support, we had to do a procedure called a tracheostomy, where we make a small hole in the neck and move the airway to the neck instead of down in the throat. So these are really dramatic interventions, but I think it gives our viewers out there tonight a sense of how bad it can be. And unfortunately, the curtains kind of closed on Isaiah's mind. Once he went on the ventilator and he was sedated, his recall of the next 2 months is probably in some dark hidden place in his brain and can't bring it forward. Because part of him wants to forget how bad it was.
Right. Isaiah, again, thank you for sharing your story. We're going to start taking calls now. Let's go to Stephen, who has been waiting. Hello, Stephen.
Yes, hi there.
Hi, go right ahead.
Okay, yes. I'm actually a grandson of a person that died from the swine flu 100 years ago. I have a second cousin's child that ended up with COVID and fought with it for 2 months, but survived. But I'm asking about, in consideration of the communicable diseases that we're fighting now, if the HIPAA laws need to be revamped or opened up to allow easier facility for contact tracing or getting to know someone that could be on your block. They don't know you because they just moved here, but they have no way of knowing how to communicate that they had COVID. Anyways, there could be a repository sort of like your driver's license with donor for organs, but not necessarily that system. But anyways, that's my concern. I think that maybe we should revisit this.
Interesting. What do you think about that, doctor? Does HIPAA prevent some information from getting out? Does it need to be revisited? Is that not what we need to be thinking about? What do you think about that question there?
Well, HIPAA obviously protects the identification and the details of somebody's hospital stay or trip to the doctor. And you can release those details, but you have to have the permission of the patient. And I certainly sympathize with the viewer. I mean, I think it's a great question. I think I'm really worried about the contact tracing. You led the story off tonight by saying Tennessee just had its highest number ever, over 3,000 cases on Monday. Well, imagine this, Ben, those 3,000 people, just say each one of them came in contact with just 3 other people, and now you have to track down 10,000 people. 10,000 people. Unfortunately, with contact tracing, that works best early in a pandemic. That would have worked better when we had a couple hundred cases a day. Now that we're having thousands and thousands of cases a day in Tennessee and other states, contact tracing is very, very difficult to do. So, again, this issue of HIPAA is important, but at the same time, if we don't have enough contact tracers to track all these folks down, it really is a moot point. And I think, again, what you saw on Monday, just a conservative estimate that those 3,000 contacted, 3 people apiece, that's 10,000 people. We would need an army of contact tracers in our state to even make a dent in contact tracing at this point.
Wow, that's a good point. And Isaiah, you have 2 children, you have a wife that you talk to, you have 2 young children. Are you aware that anyone else, certainly people were put in jeopardy, did anyone else get it? How concerned were you that they would get it?
Well, of course, in the beginning, we were just hearing about COVID. So to understand the severity of it, you were seeing it, but it had not struck home until I got it. So I remember at one point in the hospital, one of the nurses had asked me how I talked to India, and I told her no, and she said, well, she had COVID too. So at that point, I was about to jump out the bed. I was like, well, I gotta go see about her. But they were like, she's fine. She only had maybe 4 of the symptoms, if I remember correctly, that associated themselves with COVID. The children, of course, and I have 5 girls and 2 boys. Let me put that out there before they get mad and be like, Daddy, you blame us.
Yes, I'm glad you did that, yes.
It was very, once after coming out of the coma and all that stuff, and then hearing from Dr. Milstone and the other doctors about the severity of the disease that had overtaken me. I don't want anybody to get COVID-19. I can't even put it into words, the fear that I had thinking about, wow, India can have it, or Justin, or because my younger 2 kids are here in Nashville, or Isabella. For that, I mean, I just knew how I was feeling at that moment. I can't walk. I don't even think at that point I had started talking yet. I was having to kind of like whisper or whatever I could to communicate. So I couldn't have imagined them being in the hospital sick, or as sick as I was. I just couldn't put that into thought.
Well, thank goodness they weren't.
Yeah.
And doctor, before I take another call, is there any understanding, is there any better understanding, or help explain as best you can to me why it is that some people get so sick, like Isaiah, and then others don't get very sick? They're asymptomatic, or they have a pretty mild case. How unusual is that, and do we have any idea why that is?
Ben, it's very similar to influenza. Each year, in my 25 years of practicing medicine, I'm always fascinated by who gets the flu and is deathly ill with it and ends up in the hospital, and who gets the flu and has a low-grade temperature, feels bad for a day or 2, and then is back at work. Coronavirus is very similar. We certainly know some of the risk factors, things like age and diabetes and heart failure, COPD. We certainly know that there are people that are at risk, but we don't understand why young people like Isaiah may end up so sick. We have not unlocked that piece of the puzzle. And when we finally do, when we finally figure out the key, I think that'll help us a great deal to know who's at risk and who's not at risk. Why do some children get it and end up dying with COVID-19? Why do healthy 50-year-olds end up getting it and dying of COVID-19? And why do the elderly seem particularly predisposed to COVID-19? Again, this is the Achilles heel to science, is that science can't answer every question about COVID-19 because this virus has only been on this earth for less than a year.
Fascinating. All right, we're going to take a break. Cindy, Tom, we'll take your calls when we come back. We'll take a break, be back right after this.